the same time. Sorry. Community level at the same time. Now, suicide, the good news about it is preventable, and we can prevent suicide if we come to know or understand about it. Suicide is when someone wants to end their life. It's not just ending their life, but they don't want to live any further. And it's a tragic response to difficult situations and feelings. Perhaps it's more tragic because it can be prevented. I cannot move the slide.
Try stop the share and reshare again.
Okay. Oh, sorry for the disturbance because the slides are not working, but we're going to talk about it. Yes. So it's the act of killing oneself. They basically don't just want to kill themselves, but they feel that their life is not worthy. They shouldn't be living. Their life is stuck, or they're stuck in a situation which will be staying forever. They feel this is the response to the situation, difficult situation and feelings. They feel that they will never end. They will remain forever. So the only solution they can see to get out of it or escape is just ending their life, because those pains become unbearable for the people who are in that situation. Suicide is a mean to end that situation. So as the person feels trapped in it. Now, interestingly, studies before pandemic show that in 2020, in the US, over 45,000 people died by suicide. An estimate 1.4 million adults attempt suicide each year. There are thousands of people taking their life and attempting suicide. More than 1 in 5 people who died by suicide express they have suicidal intent or they have suicidal ideation. But because the people are unaware about this suicide and they think they're just saying it to get attention or they doesn't mean it, they tend to ignore it. As we all know, mental health is a little bit ignored area, though we all know if we are physically healthy, but mentally we are disturbed, we couldn't perform in our life. We couldn't use our potential. We couldn't achieve how much we can achieve in our life. So it's very important to look into our mental health and even the people close to us, our family, our friends, people around us. Though definitely, if someone normal hears someone's saying suicide ideation, talking about their suicide ideation, you will feel uncomfortable. It's natural and normal because you're not mental health professional. You will feel this, that it's something which is uncomfortable and you don't know what you should say or what you shouldn't express. So you will feel a little bit uncomfortable, but there at that point, you have to consider that if a person is saying something to you or he is talking about something, he might have a hope. You can save him or you can help them. It's a very difficult, it's very courageous act to express the feeling, because expressing feelings and emotion is much harder than showing your physical pains and your physical injuries, because you don't know, you don't trust people that how they will handle your emotion. So if someone come to you and talk about suicidal ideation, do give them importance. Do at least listen them, making them feel that you are with them, you are listening to them.
What is this?
Creating hope through action.
Okay, the study after
About
pandemic.
for worlds.
Study after pandemic showed that though in pandemic time there were higher depression and anxiety and other mental health problems, but at that time the suicide rate dropped by 3%. And can you imagine why? Because people were more connected together, and it was a normal that they felt they all were going through the same situation, and they can understand each other, they can connect with each other. But in case when a person is suicidal, or he's like scared, or he has suicidal ideation, he feels he's not connected to anyone, he cannot share anything with anyone, because no one will understand him. Even though if he try to make them understand, they will blame him. No, what's wrong with you? Everything is all right. You have everything. Why are you thinking about it? Just stop it. Think something positive. Saying it is very easy, but doing it is very difficult. So just don't stop them by saying, okay, you can divert your attention or do something. You have to empathize with them. Okay, now talking about the symptoms of suicide, the person who thinks that he should end his life or who should attempt suicide, they start talking about suicide from nowhere. They're suddenly talking, and they start talking more about suicides, like they want to know what is how they can take their life, or how they can die, or they're worthless, their living is not worthy, they should die. They try getting or collecting the mean to take their own life. For example, as we all know, psychiatry medicine, we don't get in bulk, like for 6 months, we get just for 1 month. They will start storing it. They will start storing sleeping pills. They will start storing other psychiatric medicines. And even you will find some like sharp blades and knives hidden very close to them. They try to collect those things. So if they are ready to commit suicide, they won't struggle to find things. So you can see if someone is doing this, they are in trouble. They need help. Withdrawing social contact and wanting to be left alone is a very important. Even though some people, they are extrovert, they suddenly become like withdrawn. They don't interact with people. They don't talk with people. They don't make social connection. They don't make friends. And leave the friend or making new connection, they stop even interacting with their friends and their family. They start becoming more isolated and quiet. They're more quiet, more isolated, sitting alone, thinking alone, not trying to mingle with people or go for some fun activities. The most important thing in any of the psychiatry disorder is they have mood swings, or they will have a disturbed sleep and appetite. With mood swing, as they are unable to connect with people, they are unable to talk about their feelings, they are unable to feel that they are being understood. What happens? They become emotionally high, and they become irritated because everything is stored in them. It's not coming out. They are just developing those emotions in them. And as Freud said, that if you don't express your emotion, they will come out in an uglier form. So this is the case. When they are quiet, they will have mood swings. Sometimes they will be emotionally very happy, and sometimes they will be very discouraged. Sometimes They will say positive things, but with this shift of second, they will start talking negative about the same things. They get preoccupied with that dying wholeness. What they will be searching, the ways to die, easiest way to die, how to take your life. And they will be watching movies with violence and death to make them feel comfortable that it's okay to die. Many people do this. Feeling trapped or hopeless. That's the condition, because they feel they are stuck in a situation or they are in a feeling which are never ending. They see no hope in it. They see that that's it. This is how my life is going to be. This is my future. This is not the present. This is also my future. So I'm going to end it. You will see people who are thinking about suicide, they start increase using alcohol and drugs. And our conscious mind and subconscious mind works together. Sometimes things happening in our life are not conscious. They're in our subconscious. In their subconscious, they want to end their life. But in their conscious, they feel maybe it's not a right thing. And they will start using alcohol, increasing more alcohol, as their body tolerance increase, they will use more drugs. And many cases you see they die overdosed because they take risk. They're not worried about that. They're just unconsciously wishing to die, but they start consuming more alcohol and drugs. As I said, their normal routine change, their appetite and sleep pattern is the first thing which the family members and other people note. Like they eat more to comfort themselves or they stop eating. And it's similarly in sleep, either they don't sleep, they overthink, they're just in the negative, thinking about negative stuff. Because overthinking, in case of overthinking, the researchers show 98% of thoughts which come to us are negative, and only 2% of them are positive. So when we overthink, we most probably we will be thinking negative. There won't be positive thought in it. And to think positive, it takes like a lot of training to start thinking from negative to positive. But to think negative is very easy. 98% thought coming to us are negative. And we cannot stop thoughts. We just have to change the focus. Doing risky or self-destructive things, yes. Like they will drive recklessly, they will start abusing more drugs, they will use more alcohols and stuff, which will ultimately damage them or destroy their health. And one of the characteristics of people who are thinking of suicide, what they do, they go to people and say, thank you, sorry, without an apparent reason. They start saying goodbye if this is the last time they are seeing you. So this is one of the symptoms you should be careful. Like, why is he saying me goodbye? We're going to meet in the next moment, or maybe he's just going to another room. Why he's saying thank you, or why he's saying sorry without any reason? What's the reason? You should go and talk to them. And all things also show there are personality changes, and it's abrupt personality changes. It's not like they'll slowly. So sometimes there are slow changes, and sometimes personality changes are rapid. Like sometimes from extrovert, they become introvert. Sometimes from introvert, they stop talking. Like first they were talking, but they suddenly stop talking. They don't want to communicate. They don't want to talk about anything. Extrovert person who always want to be like center of attention, talking to everyone, suddenly stop talking. So you should see, like, these are the things you should remember that and consider that these are the things when the people need your help. As an individual, as a community, we all have a role to play. Okay, now if we say, why don't we talk much about suicide? It's a funny thing, we don't even talk about mental health because we don't consider it's an important thing. Though it's very important, it's as important as physical health. For example, if you're physically hurt or your arm is broken, you couldn't lift the weight, right? But we don't consider a person who is depressed, he doesn't want to talk, or he is hopeless. Why is he hopeless? He shouldn't be, he has everything. Things which we cannot see, we don't pay much attention to. So mental health is also very important. To take care of your physical health plus mental health. And plus when someone, this is the reason, because suicide is like conditions, psychological condition. It has many factors in it. It has economical, psychological, and cultural factor added to it, due to which a person wants to commit suicide. So we have to be careful about all these things, not just mental health of ourselves, but also people around us. Now, I'm going to talk about the myths related to suicide, though we have many myths related to mental health profession, but as we are talking about suicide, so we will be talking more about myths about suicide. There is a myth, if a person is serious about ending their life, they cannot be helped. That's entirely wrong. That's false. If we follow the myth, then it ends into destruction. Its myths are not helpful. So you have to be clear about what is myth and what is reality. So I'm trying to point out a few of the myths, and I'll try to clear them why they are myths and they are not reality. If a person is serious about it, in this, it's false, because only the person, when they come to you and talk about their suicidal ideation or they talk about ending their life, it's a last hope. It's a last hope from them. They want to speak. They want to get help. So this is basically a cry for help. And if you don't help them, surely there will be end of one life. So you have to be very careful. If a person is coming to you talking about his suicidal ideation or suicide, he's at the verge. He's at the verge of ending his life. Either you can help him, support him, hold him, save his life, or you can just give a little push and he will end up his life. So be careful what you say them and how you support them. Empathize with them, listen to them, make them feel that you are with them. Don't use any discriminating or blaming words and sentence. Show that you can empathize with them. For example, you can say, I cannot imagine the pain you're going through, but I would like to understand what's going on, what's wrong. Because suicidal thoughts are not just frightening and uncomfortable for you, but it's also complex, frightening for the person who is saying them. So just try to understand them. And when they're talking to you, just try to rephrase them in your own words. If you rephrase them, they will feel that they are being listened, and plus you will make sure that what you are understanding is the point they are saying to you, and this can help them overcome it. And if you feel that they are going to end their life, just at that point, don't leave them alone. Ask someone to be with them. Seek mental health profession. And if they are talking to you, I know, because you're a human being, it's not normal for you. You will feel upset about it. So just Take care of your mental health too. Seek help for yourself too. Second myth, talking to someone about suicide could make them more likely to end their life. Yes, it's a myth. It doesn't have anything related to reality. If they are talking about suicide, that doesn't mean that if you talk or if you ask them question, are you thinking about suicide or are you having suicidal ideation, it won't push them to do suicide if it's not in their mind. But yes, if it's in their mind, they will talk about it to you. And when they will talk about it to you, you can help them. But if you are quiet, that if maybe I'm putting this idea in his mind and he will commit it, then you won't be able to help that person. So some people, they become very quiet. Just ask them, are you thinking of do you have any suicidal ideation or anything you feel your life is not worth living? Just ask them, because this can timely save them before they go further, take a step without expressing it. You can help them, because if there is a personality change, there is a mood change, there is appetite and sleep change, and they're not talking about it, they're isolating themselves, you need to take steps. You need to ask them. If a person is talking about their suicidal thoughts, they won't act on them. This is again a myth. If a person is talking about their suicidal thoughts, they want, or they have a little hope in them that they will get help. That's why they come to you. So don't just ignore. Just try to explore to what extent are they thought. Are they planning something, or it's just a thought? It's just the beginning, or they have to be referred to a professional to seek help. Then it's like you have to be you have to have mental illness to think about suicide. That's not right. Many people who have suicide ideation or who commit suicide don't have any mental illness. But yes, if there is any mental illness like depression, that can lead to suicide. But I can tell you, 1% out of 5 in normal population do have ideation of suicide at once in their life, at any point of their life. Then again, myth, when someone dies due to suicide, they have committed a crime or sin. No, they were stuck in difficult situation and thought they couldn't get out of it. That's why they attempt suicide. And be careful when you say this thing to a people or a family or friends who are in grief. They lost someone. They are not happy. They are in pain. But your words can make them feel more painful. So be careful about what you say to anyone around you. Suicidal behaviors is attention-seeking behavior. Again, false. Suicidal behavior, some people, they do start with cutting themselves, like they have minor cuts. They seek attention to get help. They don't want to do it. Their psychological pain is more than that physical pain. They cut themselves to get help. They want to get out of it. Some people, I have seen some cases, they come with big thumb on their head because they try to hit their head. So everyone can see they need help. It's we may say, many people around us may say it's attention-seeking behavior. If it's attention-seeking behavior, they won't hurt themselves. They will fall, but they won't get hurt. They will do things, but won't hurt themselves. When someone gets hurt, that means they need help. They are in pain. How to identify people having suicidal thoughts? And this is what we talked about before also. They will talk about wanting to die. They will have great guilt, shame, and they will feel a burden on others. These are the excuses or negative thoughts they are developing to verify their thought that they should die. Then look, I have done so many things wrong. I'm guilty. I'm ashamed. So I should end my life. I'm a burden to others. So I should end my life. Then they feel empty, hopeless, trapped, having no reason to live. They don't feel that they have any reason to live. They're extremely sad, anxious, agitated, or full of rage. And they want to they take their revenge on themselves. Like, by killing myself, I'm controlling everything. Unbearable emotional or physical pain. Yes, people who express unbearable emotional and physical pain can attempt suicide, because if, for example, if they are having any physical pain which they feel it's unbearable and they shouldn't be living with this pain, or people having stroke or any condition in which they get paralyzed, they think that they are useless now, so they should commit suicide. Their behavior changes, making a plan or researching ways to die. They make plans, research ways to die, withdraw from friends and their family and everyone. They're taking dangerous risks, such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, using drugs or alcohol more often. So if this all condition help, you should seek help, or to prevent suicide. Risk factor for suicide. There are many risk factors, like as I told you, there are economical, social, psychological factors, cultural factors which lead to suicide. And interestingly, men are more prone to commit suicide. Why? Men are at more risk. Why? Because men are supposed to be strong. They shouldn't be expressing their feelings. They shouldn't be seeking help from a clinical psychologist. So when they couldn't express themselves, they opt for suicide. Then men are more affected in relationship breakups and deaths of loved ones than the females. Then men are more people who have access to lethal means, and they will just use lethal means to take their life. Then mental disorder, yes, they can cause like depression can cause you feel hopeless, helpless, in which it ends up in suicide. Then some people are impulsive. They feel that this is it, it's not going to end, so that's it, I'm going to take my life. So in this condition, you have to ensure them this condition is timely. This feeling is for now. It's not going to stay forever. It's not going to you have to focus on present, then on the future. Then ask them things like, if they leave, what will happen? And if they die, what will happen? Emphasize more on living. Then who are at a more risk of suicide. People who are having health issues, depression, substance abuse, bipolar, schizophrenia, personality trait, conduct disorder, anxiety disorder, serious physical conditions, traumatic brain injuries, and then environmental, they have access to lethal means. Their stressful life event like rejection, bullying, relationship breakup, exposure to another person's suicidal graphic or sensitized accounts of suicide. Then they might have previous traumatic experience, childhood experience, abuse. Their family structure is not very strong, or they're not people who are well connected with other peoples. What can we do about it? How to take care of people with suicidal ideation? Take away all the risky things. Talk to them. Don't leave them alone. Support them socially. Try to empathize with them. Try to understand. Be more observant and look for changes in their behavior. If they're on medication, supervise. Are they taking medicine on time? They're collecting it or no? Be careful about what you say to them, because that means a lot. That can push them to commit suicide, or that can help them get out of this situation. In which you should surely meet a mental health profession is sudden change in behavior, history of depression. Start talking about suicidal ideation when someone start talking about it. Prevention and control. There are many strategies at different level, like at individual level. I have talked in about individual level, but there are like some society level and families level which can be changed. Like for example, if economic support is strengthened, plus strengthening access and delivery of suicidal care, coverage of mental condition in health insurance policies, because most of the health insurance policy don't cover mental health. Create productive means, promote connectedness, teach coping and problem solving skills, social skills, emotional development, parenting training, family relationship program. This all are done by psychologists, clinical psychologists. Though it's a myth, they will only deal with abnormal people. No, they don't just deal with abnormal people, but they help you in your self-growth, building social skill, problem solving skill. Most probably the people who commit suicide don't have problem solving skills, and they have poor coping strategies, which have to be changed. We as a human being, we always have to work on the situation. The situations are not going to change according to how we desire them. We have to modify ourselves. We have to become flexible to work on them and to progress in all those situations happening in our life. Identifying and supporting people at risk. It's very, very important. So that's it of the presentation. Thank you so much for listening. If you have any questions, you can surely ask from me. Yes, any questions? Any confusions? Because we
give
all
some
have.
time. Yeah. Let's hold on. Let's give some time.
Okay. We have to all work together on these things at individual level, at societal level. We have to focus on working on this all things. changing ourselves can also help many people.
Yeah, we have a question in chat. If a
Okay.
suicidal patient comes for consultation, what are the steps they will go through with the therapist?
Okay, first we have to identify like to what extent he is suicidal, then removing the risk factors, then helping him like making people connect with him or together with him, exploring and listening to him, helping him in the areas he's weak in, or because they feel that this situation is going to be forever. We have to make them understand, no, it's not going to be forever. And if needed, medications are also recommended. And clinical psychologists do refer to psychiatrists for medication. I have a very good case. I remember about it while talking about one of the patient came to me. He was 69-year-old. He was severely depressed. And because sometimes consciously we are unaware about what we are going through. Many people, they're consciously not aware. Unconsciously, yes, there are many problems. So they just find excuses. Oh, maybe this will happen, then I'll be all right. So he came to me with hopelessness, helplessness, and what his family said, because he is exhausted from our work, because we all are good at assuming things. So they assumed that it's due to work. So they said, you take retirement from. I said, okay. I said, family, okay, he will take retirement. Can you please go out so I can talk with the client? When I started talking to him, he had many relationship issues. He had many pent up feelings in him. At that point, I called the family and I said, look, he needs immediate help. He needs medication and he needs counseling. Please pay attention to them. They said, no, it's okay. We know it's just work. He will resign today. It will be okay. I said, no, it won't be okay. You know, even someone very close to you, loved one, they couldn't understand how serious things are going. So if any mental health, if you feel there is a problem, just go to mental health professional and they will try to explain you. And you know what? That case ended in the hospital because he tried attempting suicide, but thankfully he was saved. And then the family started counseling and psychiatry help for him. So don't wait for that point. Don't assume things. Oh, this is the problem. It will be all right after this. No, it's not just one problem. It's a complex of, it's like many problems working together. So try to explore them all. Try to understand that person as a whole. Not just one thing is leading to the other thing. It's not the case. As a human being, we think differently. We have like, the problem is not just one point, work. It can be also like your genetics. It can also be your psychological condition. It can also be your personality type. You're more anxious. You're more like prone to depression. So we have to work on that person at all level, bio, psycho, social. Socially, he should feel connected. Psychologically, he should be heard and understood. His personality trait, everything's together make him think what he is thinking.
We got another question. What is the difference between going to psychiatric and a psychologist?
Okay, that's an interesting question. I usually answer many people. Psychiatrists are MBBS doctors and they prescribe medicine. They assess, diagnose, and prescribe medicine. Whereas clinical psychologists do psychometric assessment like IQ assessment, learning difficulty assessment, anxiety, depression assessment, score them and see the level according to the tools used. Then on the basis of them make diagnosis. After diagnosis, they are not they cannot prescribe the medicine. Yes, that's why if the severity of the problem is more, they send them to or direct them to the psychiatrist, as well as working on developing their problem personality things. Like if they have to work on changing their negative thoughts to positive. Working on because certain things are under our control, certain things are not under control. We work together to control the things under your control, which are your thoughts, behaviors, and actions, not working on other people or other things. Working purely on yourself, self-growth, confidence building, self-esteem building, then becoming emotionally strong, then problem solving skills, then dealing with your depression, dealing with overthinking, change of focus, dealing with psychiatry disorder like OCD, anxiety, depression, ADHD, autism. So I think it's clear now.
Yeah. Same person's another question. Once you assess the patient, do you refer them to a psychiatrist?
Yes.
What level and when do you refer?
If they are severe, because when they are severe, they're not ready to listen or they're not ready to think about anything. So to calm them down, to make them come at counseling level, I do refer people. I don't know about other clinical psychologists, but I do refer them. So they can like work with me after being little stable.
Okay. We have one more last. What you can advise to people who lose hope and thinking about doing suicide?
Focus on why you should leave. Count your blessing. Be more connected to people. Talk about your feeling. Keep a journal. Write what you feel to identify if they are logical, illogical, they are realistic or unrealistic. And do make your activity schedule. Don't just sit alone. If you're going to sit alone, you're going to overthink. And when you're going to overthink, 98% of them are negatives. So it's impossible to focus on that 2%. And that 98% are purely assumption, illogical, unrealistic thoughts. Because you are not going to stay in that situation forever in your life.
Okay, one more question. What is your one-line advice for all?
Look after your mental health. That's very important, because if you're physically okay, you're mentally not like happy, or you're under a lot of stress, you cannot work, you cannot use that, your physical potential, you cannot use them. So look after your mental health.
Zobia, there's one more question.
Yeah, sure.
Sometimes a circle of people whom you are interacting to are the ones who are giving negatives. Does this mean that we need to ignore them or change the circle of friends?
Change the circle of friends, because most of the time we do have connection with toxic people. Whatever you do, it's your blame. They will not consider what they are saying or what they are doing wrong. They will emotionally make you dependent on them, and at the same time, they will make you feel that they are with you, but in actions, no, they are not with you, because they keep demotivating yourself. They are jealous of you. They will make themselves appear they're always right and you're always wrong. So you have to change that circle. You don't need to be in toxic relation forever, because this toxic relation is going to end at a point. So better end it when you start understanding that it's a toxic relationship for you.
One last question, Ms. Zobia.
Yeah,
What
sure.
are the major facts nowadays? That's why suicide cases are rising.
People, there is a lot of competition, or people are not connected to each other. Sometimes they're not very sincere. They're not concerned about other problems. They're so absorbed in their own things. The social connection is becoming, it's decreasing day by day. Social connection. Then they're more into social media. They are more into like a world that doesn't exist. They show something. They don't do what they feel like. They have a cover on them. They pretend to be like what they are not. And this pretending causes identity crisis, which makes you feel low. And then this lack of connections, lack of sincere friends, then feeling that not trusting anyone. If you talk, they will give you sincere advice, or they will just like make fun of it. There are many like changes in the environment. There are many changes in life, due to which it's like increasing. The mental health problem are increasing. The most important thing I feel is the lack of social connection. The children are on their phone, parents are on their phone, everyone is on social media pretending something, but in real they don't feel like that. There is clash between what they really are and what they are showing.
Thank you, Ms. Zobia.
Welcome.
She said that, thank you, Ms. Zobia. This is very wonderful, very helpful to our lives, either at work or personal.
Welcome. Thank you so much.
Thank you. Thank you so much.
Let's give 3 to 5 minutes more if anybody willing to ask questions. All right, then we will conclude. So thank you everyone. Thank you, Ms. Zobia. It's a wonderful presentation. We look forward for a few more webinars like this with the different topics.
Sure.
It was wonderful questions actually today. Nice questions, and it is so interactive. So thank you everyone. Thank you for attending this webinar, and we wish you all a great day ahead. Bye-bye.
Thank you. Thank you.
Thank you. Bye. Have a great day.
Thank you.